how do you become a vet? How many years of studying and followed by internships do you need to do? Because let's clear that. Because again, there's the feeling, अरे ये तो बकरी का डॉक्टर है, उल्लू का डॉक्टर है, इनको क्या पढ़ाई? एक होता एक ट्रेंड है in still majority part of India.
After 12th, we have a course called BVSc AH, which is basically Bachelor of Veterinary Science and Animal Husbandry. The confusion is after that, what is it?
Are there still enough places in India? I'm talking about India. I'm not just talking Bombay, but about India that will cater to your babies.
But in the places that are cities that are, you can say, developing, in the outskirts, I feel there's a lot of lacking when it comes to veterinary medicine.
There are a lot of people who are adopting dogs. We also see a lot of celebrities like John Abraham or Farhan Akhtar or Diana Penty adopting a lot of indies. And obviously seeing that again, we see a lot of people starting to adopt. But how will this trend completely shift from buying to adopting? Hi, Dr. Carvalho. We'll be talking about a lot of things concerning animals in general. We'll try to debunk, a lot of misheard facts, a lot of misrepresentation, a lot of ideas that we have which may not be true. So let's get the episode started. Welcome to Twisted Truths. I hope we have a great conversation.
Yes.
In India specifically, in the Indian subcontinent, I would say, including countries like Pakistan, Bangladesh, India, obviously, there is a lot of, I would say there's still a lot of lack of awareness when it comes to the veterinary sciences, Like the respect or the awareness that is there in Europe or in US, it is not there in India. How much do you agree to this statement of mine?
I do agree a lot when it comes to respect, when it comes to, awareness, because I still right now, vet practice is booming, especially after COVID. And talking about the pets, before I used to get a lot of dogs because Mumbai, India, we have a lot of dogs. After COVID, suddenly cat populations like this. There are feeders, there are rescuers. There are couples who don't want to have children, but they have cats. So cats are basically their babies. So right now the awareness is there. But on the other hand, there are these type of pet parents. And on the other hand, when I go out or if I'm going just randomly for some event or bump into people and they'll be you're a doctor, obviously. Now, doctor means homeopath, Ayurvedic. They'll be which doctor? If you say vet, they still have that thing that kutte wala doctor.
Exactly. That is the first reaction that is there.
So some people still have that, but I believe at least in Mumbai, India, it is changing.
Changing, obviously.
Yes, right now.
First thing, how do you become a vet? How many years of studying?
Don't ask.
And followed by internships do you need to do? Because let's clear that. Because again, there's the feeling, अरे ये तो बकरी का डॉक्टर है, उल्लू का डॉक्टर है, इनको क्या पढ़ाई? एक होता एक ट्रेंड है in still majority part of India. So let's clear that today. How hard do you have to study and how hard do you have to, put that sweat and blood to be a doctor, to be an animal doctor?
So basically, for any medical background, you need to do your 11th and 12th in science. That is clear for everyone. The confusion is after that, what is it? And many people are misguided. So it's a good thing I've asked this so that people get to know, because different people say different things. There's no proper site where you get accurate information. And Google also, there is abroad it's called vet school. It's very different in Mumbai, in India. So people need to know that. So after 12th, we have a course called BVSc AH, which is basically Bachelor of Veterinary Science and Animal Husbandry. The conversation we had before, I was telling you that we learn about small animals and large animals, is a fact because you cannot choose when you're doing this basic course.
Obviously, yeah.
It is a course where you'll be taught about everything, and later on, you get a 2-year post-graduation where you specialize. So basically, after 12th, when I gave my exam, it was called NEET. There was NEET and CET. And then there's an all-India pre-veterinary exam, which is called AIPVT. So these are these pre-medical exams that you have to give to get into the course. So every year that changes, but I think right now CET and NEET is there. How you have the engineering, also you have the exams. So you have to get a score in that exam, and then you can apply for a college in BVSc AH. There are only 5 colleges in Maharashtra which offer this course. and only one college in Mumbai, which is the Bombay Veterinary College, which has two branches. One is at Goregaon and one is at Parel. So to be precise, it's a 5.5 year course.
Okay.
And the first 3 years...
Including post-graduation?
No.
Or without post-graduation?
So that's what when people say that, oh, you're just a vet, it's actually, the duration is longer than an MBBS
They
doctor.
fail to realize that.
Yes, because I told you that we are learning about everything. We have to cover all the animals. In fact, reptiles and fishes, we learn about everything. Like the basics. And then later on, you specialize in whatever you want to. So the BVSc AH is particularly 4.5 years and 1 year internship, which is provided by the college itself. Because I didn't pass out recently, the syllabus changed. So that time we had internship only in Maharashtra. But right now they have made it like pan-India. So people go outside, like in different cities in different states to practice.
Right.
So my internship was 6 months, but right now they have increased the internship to get more exposure for children to be trained.
Right.
So it's a total 5.5 year course, after which you will get your degree. And after that, if you want to specialize in India, it's a 2 year postgraduate.
That makes it 7.5 years.
Yes. And then if you want to practice abroad, you have to apply for a license and give different types of exams. This is the practice that I'm telling you in India. After your 5.5 years, you get a license for which you are allowed to practice in your state. There's a state license and there's a all India license.
Right.
So after this, you have to just apply and you get that.
Right. How does it feel to treat somebody or someone who can't talk and express their pain?
It's a blessing, I think, because initially when I'm talking about the course also, I want to tell you there are different types of streams. If we talk about it, there's medicine, surgery, gynec, wo to apna normal practice wala ho gaya. But there are other stuff like there's genetics, there's animal genetics, there's nutrition, there's physiology. So there are non-practitioner courses where you go into research, you can become a nutritionist. There are like how apna food wala, Whiskers ho gaya, pedigree, there are so many food brands, okay? You get to work in the companies, in the research area, on an executive post. You can do an executive MBA. So there are different types of courses in the veterinary field itself. So it's not just to like just practice what you're saying.
Right. Overall, the pet industry is booming in India right now, you know. However, there's a downside to it. We see there's a lot of clinics opening up. We see there's a lot of grooming salons opening up. We see a lot of play areas opening up. But are there enough proper hospitals opening up to get those proper checks in place? Because if your pet is not doing well and you want to get your blood test right, you want to get your scans right, are there still enough places in India? I'm talking about India, I'm not just talking Bombay, but about India that will cater to your babies.
See, I have a client base which is in Mumbai, but then they have come from, there are some who have come from out, right? So I have friends who have their parents in Uttarakhand, some in the outskirts, in the villages, like if you talk about Marshall and Kolhapur and here and there. There's still a lot that can be done, especially in places that, you know, like are not like the me. Like if you talk about Bangalore, Mumbai, Hyderabad, these places, there will be vet help because there are people, it's developed. But in the places that are cities that are, you can say, developing, in the outskirts, I feel there's a lot of lacking when it comes to veterinary medicine. Because in fact, even there are very few government centers over there, and most of the time no one's there over there. So and then there's no one to give them proper guidance also, because the people also over there, you don't even know the authenticity because there's no one to check anything over there.
Correct.
So I feel there can be a lot done more.
Why do you think is this lack of medical infrastructure when it comes to the animals?
So as I said that there are many, like right now there are hospitals, there are clinics, there are many investors who are wanting to come into the veterinary field, obviously because there's money. It's become a business. As you said, grooming, there are pet play areas, because people are willing to pay for their pets. Before, people used to ask me, you know, they used to be reluctant to do some things. There are a few people like that now also. But right now I see most of the people, like, you know, when it comes to a sickness, they are like, you know, ready to do everything for their pet. So people are ready to pay that way. But then in some cities and some areas, there is not much of infrastructure at all. Like, they have to work on this. I agree with you.
Again, with so many people adopting pets, people getting pets home, there's this culture of buying, which I do not agree with. What is your take on people who buy animals or who buy dogs and cats rather than adopting them, when there's this trend of adopt don't shop, whether you adopt an indie or whether you adopt somebody who's abandoned or somebody who's not well, or maybe even a police or an army dog who's just retired. So despite being an educated public, we see in the urban areas there's this culture of buying rather than adopting. Obviously, it is again shifting. There are a lot of people who are adopting dogs. We also see a lot of celebrities like John Abraham or Farhan Akhtar or Diana Penty adopting a lot of indies. But and obviously seeing that again, we see a lot of people starting to adopt. But how will this trend completely shift from buying to adopting?
So I love strays. Like if you come to my clinic, there's a poster when you enter which says adopt one shop with a photo of a cat that we had adopted. So I personally feel that, when you adopt a pet, like be it a dog or a cat, the bonding is different because that, and I've also seen with the pets who are adopted, they are so attached to their owner, they're so grateful, they are so protective, and you get rewards in exchange for love, and it's like a forever togetherness thing. So I've seen people who have never regretted this decision of adopting, and I feel personally indies have the best immunity.
Absolutely, yes.
The best. Like I see nowadays, especially, I see German Shepherds, Labs with hip problems, spine problems, arthritis, which before used to come like after 12 years, 10 years, but at such a young age they're getting arthritis problems. Cancer's become a big issue in pets.
That is also, I think, partially due to inbreeding, right?
In beagles, labs, especially in these big breeds, even German shepherds, which even before there was less diagnostic tools to this thing. So I am also ruling that out. I'm not saying that it was not there before. It's there, right? But right now I'm seeing all this at such a young age. So breeding is a very important aspect in this. You have to ensure that the source from where you're purchasing or you have to make yourself very sure that you're buying a good breed. Because long term, you're like after owners buy something and after 1 month or something happens, they're already attached. So you cannot disown them. So you have to treat them, and then when they come to know that there's something wrong with the pup, it's very disheartening for them.
Right.
So
but don't you think this entire line, buying a good breed itself, is flawed? You should not buy love. Like, you should adopt in general.
Exactly.
And how will this awareness come by that you should not buy at all? You should just adopt.
Firstly, I feel that, from wherever, like all these breeders, there should be licenses or,
But
there's a lot of faulty breeding.
There's hardly any, when there's a lot of inbreeding,
Yes.
The sister and the brother, they are mated. And that results in
and
babies.
genetic deformalities take place.
Exactly.
Yeah, that is very sad that it is happening.
And that's because of the demand. If there's no demand of breed dogs, that will automatically go down. So as a vet, as a doctor, what is your take on people who even in 2025 are deciding to pay money? And
I think y'all should adopt. Don't even think about it. Adopting is the best option. And as I said, that they're the best. Like they have it's very low maintenance when it comes to grooming, and they're self-trained and they have good immunity. They rarely fall ill. Be it cats or dogs, I think you have to adopt.
Right.
Then
there's this entire now culture of getting Huskies in India. That's something which is really gone up, And then there's, I think, Siberian.
Yes, Siberian cross, first generation, second generation,
exactly.
third generation.
So as per our knowledge, they are not suited even to the Indian climate, Yet people are getting them. It's a complete show-off culture, I don't think people are getting them for love. It's mostly just to show off that they have money and they want to spend, status symbol and all of that. How difficult is it for those breeds to survive in India?
Over time, because of the breeding, they have managed to come to a point where the dog can survive, but obviously in AC.
Right.
Most of the time, the dog has to be in AC.
Right.
So I know people who have purchased Huskies and they don't. I feel if you all don't have that kind, you need money.
Obviously.
For that, you need a centralized AC in the house. The dog needs to be groomed at least once in 10 days. At least. It should be ideally once a week, but at least once in 10 days a bath, hair clipping, nail clipping, everything has to be taken care of. Because, even because of lack of grooming, like there are stuff like ticks, that tick fever that can happen. And because of dirt, they can get skin infections, bacteria can come in. So they have to be taken care of. So as I said before, right, if you take an indie, it's just nothing. You have to just take them for walks. You
Yeah.
have to take care of the nutrition
Right.
and their vaccination and deworming.
Right.
And then the vets always have a concern. But huskies, firstly, are an expensive issue. Second thing is a temperature that has to be regulated.
Always.
And the third thing is, I think they have better options than they can go for that rather than purchasing a husky. Yeah, if
Right.
there is some abandoned or some a cross or someone that they want to adopt, it's fine. But still, it comes down again to the breeding then.
What is your take on people who get dogs and cats home and then they throw them outside?
That's pathetic. Of course, it's pathetic. I don't really support such people. And right now, in fact, we get a lot of abandoned dogs. As I said, when they purchase and because there's some problem, they want to give it back to the breeder. If the dog has passed that age where they can sell and it's too big, and they also know that the problem is grave, they don't want to take it back and then they abandon. Or I know I'm a visiting vet at some of the fosters and some of the boardings in Mumbai. So they have some dogs who are just kept over there, abandoned, or the owner is not ready to keep because they have got another one because the first one has a problem. So the dog is just kept in a kennel or just kept for adoption, and the dog is waiting for a new home. So it is a pity that such things happen. And I think people should not do such a thing because they are making an animal suffer. It's sad.
You've been in this field for quite some time now.
Yes.
If I have to ask you to maybe give us one heartwarming story, as well as one really painful story of maybe somebody abandoning a dog, and heartwarming story of love or togetherness, what would it be?
Okay, so I also have a facility where I can admit cats.
Okay.
Because of the constraints of noise, I don't do dogs, I just do cats. There have also space is better to manage,
obviously,
right?
yeah.
So there's this condition called FIP.
Okay.
It's called feline infectious peritonitis, which is predominantly caused by coronavirus. जैसे humans में होता था coronavirus, basically layman's language, cats में भी ऐसे होता है, corona virus हो जाता है. And not many people know about this. It's a new disease that has come in. The treatment for this condition is 84 days of an injection, which is not available in India.
Acha.
It's illegally imported over here. People are trying to get the drug legally. Remdesivir also works in this condition.
Right.
But there's a drug called GS, which has to be in for 84 days. So I know a lady who rescues a lot of cats and she feeds 40 cats a day, which is really amazing. And I knew this cat because this cat I had treated before. So, and she said that the cat is not well, and I was like, okay, I'll take her in because anything happens, she would call me. And then I did blood tests on the cat, had a liver infection and this and that. And I admitted the cat. I was doing the treatment, and eventually I diagnosed that the cat had this condition. And then I told her that, this is the treatment and it's going to take 84 days and the injection is very expensive. So we were thinking about, how are we going to figure out, and it would cost her like over a lakh, like 1.5 to 2 lakhs, including everything. So she was a little skeptical about what to do and how to go about it. But then eventually, she didn't want to let the cat die. So we decided that we'll order the medicines first and then we'll, start the medication. And she showed signs of recovery. And a month, 2 months, 60 days. So she was in the cage before. I had to give her in the cage. And eventually she would get bored in the cage, so I had to keep her out. After some time, I had to keep her in isolation. So after half her dose, 40 days were over, I could just allow her to socialize a little, not with the other pets, but give her some outside playtime. So eventually she didn't want to go back because it's 84 days is a big time of, shifting. And then the lady also didn't want to keep her back on the streets. And I got really attached to her. So basically I kept her.
Wow.
And now she's my cat.
Right.
And she's healthy right now. That was one thing that
That's
I
such a
could
sweet
do.
Story.
Yeah. And I think everyone gets attached to such pets, and because of constraints. Initially I thought that, what if I go out? How am I going to manage? But everything gets sorted. So I think, it's just that you'll have to adopt and then don't think about it.
Exactly. So, cats are often considered to be not as loyal as dogs. There's this huge, uh, I wouldn't, this like a culture thing which has been there
Yes.
for a long time.
Yes.
So, what is your take on that?
I feel that until you are a cat owner, until you stay with a cat, you won't know what is a cat's love. So till now, the situation with my cat is like, and I think it's with all the cats. They want to cuddle when they want to be cuddled. They don't want to be cuddled when you want to cuddle them. But then it's like this love-hate relationship sometimes with some owners. But then I know owners who come with scratches and bites, and I'm like, and I literally ask some owners because they are sometimes it's so evident. I was like, why did you cut your hand? They're like, no, it's my cat, and they are not saying it with frustration also.
Yeah.
So like people understand cats, and I think until you spend time with cats like a week or two, you want to understand. It's they're weird. Cats are weird, but they're weird in their own way.
Right.
That way.
And people, like so many people right now, as you said, we were talking about, they are deciding to become a dog parent or a cat parent rather than a human parent
Yes.
in general. So how is this shift coming by? And for me, I think it's a beautiful idea. What is your opinion on this?
So we have a lot. I mean, I have a lot of couples who come in, and even the queer community, like who I have people who come in with their partners and they're staying together and they like have 5 cats, 10 cats, and such. This community loves cats. I have seen that. Okay, and they really take care of their pets like their babies. And there are some owners like who don't
Pets
really
should be
want to
treated
go.
like their babies,
Yes, and they don't want to have babies, which is fair enough because in today's world, even like I don't know if I want to have babies, but I want to have more cats. So it's like that, and it's a like it's a responsibility as good as keeping a baby, but then it's different because the love, the relationship. I know clients who take their pets along with them everywhere they go. They go on vacations, they spend time together, and it's like therapy for some people. I know a lot of owners who have gone through a lot of mental traumas, emotional distress, been through some death of a person or a divorce or something like that, and they've got a pet, and it has actually given them a lot of relief and warmth. And even studies have shown that pets help improve mental health because they help release the happy hormones, endorphins and serotonin. And it is also a very good thing for people who are staying alone. Like I
Right.
know people who don't want to socialize, they don't have friends, but they have cats. So the cat is doing their thing and he's doing their thing that way.
What are some of the common mistakes that a pet parent generally makes, whether it's dogs or cats?
Okay. I think I know Google is a blessing, but sometimes it can also be a curse because even I use Google, but I can't use it for everything. Like I think that the parents, some mistakes that pet parents make is self-medicating. I tell my clients that okay, fine, if there's a fever or something, you'll inform me. I will tell you all. Like there are some clients who I just will. I have seen their pets before, and I every time a new pet comes to my clinic, I tell them, if it's a puppy or a small kitten, if the puppy is going to vomit or have diarrhea, just let me know. Okay, if it's urgent, you can just call me in the night also, but just let me know before you're medicating something. Because I have known some cases where they have given wrong medicines, they have given overdoses, and they have come with, reverse side effects. And then because of the medication, then you have to treat poisoning happens. Some people use excess of paracetamol in dogs, which is not recommended. And then because of that, the condition becomes worse. So that is one thing, self-medication. And second thing is not coming like cats. I know like if you do vaccinations, if you regularly deworm them, and if you groom them, you don't need a vet visit. But cats are very deceptive. So I feel if a cat is not eating for like more than 24 hours, you should get vet help.
Right.
Because that's not normal with a cat. Dogs, you can easily, owner will easily come to know that a dog is not well. But it takes time because cats are deceptive in nature by their own. Like, they don't really show. I don't even know if you have ever seen a stray cat pee or poop because they don't do it in the open.
Very rarely.
Yeah.
Very rarely.
So if I ask her, if they'll say my dog is not eating, I'll be like, how is the pee look? If they say it's yellow, I can see it's a liver problem. If they'll say that the dog has diarrhea, I can say, okay, fine. But cats ka kisi ko pata nahi rehta hai. There are many owners who I know have indoor-outdoor pets. Like they are staying on the ground floor, the first floor. They have cats who come in their house, chill and go out.
Right.
So it's very difficult to treat such cats. I think, being regular with your vet, being in touch with your vet helps. And also nutrition, taking good care of their nutrition. That helps.
Are dogs and cats lactose intolerant?
So this is a debate, okay? But I have had, in my opinion, it all depends on what you're giving them from small.
Acha.
Okay, if you find that your cat or dog is not used to milk from the start, then you avoid giving. In general, I ask them to avoid, but if I know that there are some cats that are just having milk and they're alive, okay.
Right.
So I'm a vet, but then I know that I am a pet lover before being a vet. So everyone has given milk to the cats. I don't
Obviously,
recommend
yeah.
it, but
Yeah,
I feel that if someone is giving it, like I have a lot of clients who are like Gujaratis and clients who are on a vegetarian diet and they want to do something for pets, so they give milk outside, and I think it's okay. It's okay as long as the dog or cat doesn't have an issue. If they find that there is an issue, then they should stop.
Right. There are also some people who claim to talk to the animals. They can understand what animals say. How true is that?
Hi, there's this thing that is come up called animal communication.
Ha ha ha.
So I don't have a very strong opinion on it.
Right.
But so there is for pets there's animal communication, for humans there's tarot card reading, right? Like all these type of, I think they do tarot, reiki and pranic on animals also now. So I initially would not believe in it, but once there was a situation where a pet was lost and I was distressed, and I think when you don't have an option, you tend to go for such an option. So I cannot say if it's true or not, but there are people who communicate. Yeah, medically, if you're communicating medically, once there was a surgery scheduled and this lady was saying that she doesn't want to operate on a pet because the communicator said that the pet doesn't want it. That is something that I'm against, letting the communicator decide what your pet needs medically. Emotionally, mentally, behaviorally, I think communication is fine. But when it comes to a medical issue, I'm against it.
Right. What's your stance on people who keep exotic animals as pets?
So as I said before when we have a conversation, I'm not an exotic vet. I am more predominantly a small animal vet. I deal mostly in dogs and cats and a few large animals. Birds and tortoises and other wild animals, if they come to the clinic, basic stuff I do, otherwise I refer. But I am against the animals, like if like the Indian ones are not allowed, they're not legal. So I'm not in favor of them being kept at home because it's against the law and they can get into trouble. And also there are sometimes some vets that refuse to treat them. So if there is any problem, they won't get medical help at the right time. So I am not in favor of exotic animals which are illegal.
And what about people who keep birds in the cage or fishes in the aquarium? Don't you think it's suffocating?
It is. But there are many people who are keeping like fish tanks and small fishes from a very long time, and it's a legal thing. So until
Legal
there's something.
Not always be ethical.
Yes, it's not. I mean, I don't really like it. I don't have fishes. I don't have birds, and yeah,
birds are meant to be on the sky.
Yes. But I think it has reduced now. I've seen very few people keep this thing. Of course, in a few restaurants, I've seen flower horns and some ornamental fish. But in houses, I have seen it reducing. I don't really like keeping birds in cages.
Should not, they are meant to fly.
Yes.
What is the most common behavioral issue in pets?
Common behavioral issues, okay. I have seen a lot of bouts of, anxiety that has come. Recently, I've seen a lot of, dogs getting anxious, and even in cats, the same behavioral issues. Like anxiety is coming in. Cats anyways get stressed a lot. So stress and anxiety are the two behavioral issues. In dogs, we see, like because of lack of training also sometimes, dogs involuntary peeing out of excitement. That is one behavioral issue. Second thing is some bouts of aggression like biting. Or I have also seen that some dogs who have been through some kind of trauma, show behavioral issues. Like there was a lady who adopted a dog and she was really happy initially, and then one day she called me saying that she wants to give up her dog. I was like, why? She was like, suddenly her dog has gotten very aggressive and she was getting a baby, so she didn't want to take the risk. And I was not in favor of that. I was like, okay, fine, just give it some time. And then we didn't have a conversation, but then she called me for a vaccination. And I was like, wow, what happened? And the dog had really calmed down. So she was like, she found out that it was her trainer. It was her dog walker who she was not liking. And there was some problem that he was not behaving properly with the dog. So there's always some element because of which the dog or cat has behavioral issues, which has to be ruled out. So she sacked the walker and the dog was fine. So it's always something that triggers them because of which they have behavioral issues.
What's your opinion on euthanasia?
Okay, as a vet, my job is to save lives. To treat, to save lives. But when you talk about euthanasia, I look at it like releasing the dog or cat from its suffering. There are many vets who I get referred for cases sometimes where the primary vet is someone else and the vet refused to euthanize because they don't do it at their clinic or they don't want to do it for their case. Obviously, if some dog or cat I feel should not be euthanized at that point, I would refuse. But then when I feel like a pet's quality of life is going to deteriorate or there is no quality of life, I would myself explain to the owner that it's time where we should put the dog to sleep and the dog will be in a happier place then. Right. Because the pet, if it's my dog and for example he's 12 or 13 years and he has lived so many years happily with me, I've seen him run, be a happy puppy, eat well, sleep well, and suddenly I'm seeing my dog suffering. Even I don't want to put him in such a place where he's just going to be like a vegetable in my house.
So would we do that to humans as well?
It's not legal. It's only legal in the Netherlands, if I'm not mistaken. It's still not legal over here.
Right. But in case it's legal, what will be your opinion then?
I think then there have to be very strict. Like as I said before, I told you that if there is a slight chance when I feel that a dog or cat shouldn't be euthanized, then I will tell them that you should try an alternative.
So it should be 100% foolproof. That's what you're saying.
Yes. There has to be very strict protocols, and there has to be a lot of cross verification and all that before we do something like that.
How do you think we as the general public as well as the government, how important is our role as well as the government's role to encourage people from adopting from shelters rather than buying breeds?
I think it's a beautiful initiative that everyone can work on. I think the government should collaborate with a lot of NGOs. They can also approach private clinics and put up posters. They can go to like cafes which are pet friendly, normal cafes where a lot of young crowd or normal restaurants, and they can ask them to put up these posters where people can look at it and create awareness. And other places also like malls and other public places, they should have some kind of slogans. Even like while we are traveling, they can have it. They can have a big campaign, and they can also open centers of their own where like some people, they find pets, but because of lack of financial capabilities, lack of place, they don't really know what to do. So the government should actually take up initiatives for strays and do something for adoption, because there are many people who are willing to adopt right now. And there is awareness. It's just that we have to spread it a little more.
What makes Indy the best dog breed, especially in India?
Firstly, the immunity, as I said. Okay, like a dog, when you say if you have a pet dog, you'll come to the vet for vaccinations, deworming, my dog has fever, this, that. I have seen people there are some dogs that you cannot touch because they are feral. They don't come in hand. And they're like 12, 13, 14 years. They just, they eat anything. They eat bones. They eat out of the dustbin and still they're alive. And you hardly see them ill. So that's what proves that the immunity is really good. They don't need a lot of grooming. They have short hair. Most of the, except for the north parts,
in the hilly areas,
you have some bushy dogs, but most of the areas over here have short-haired dogs. So grooming is not an issue. You can just give them a bath at home and they're fine. And they're very loving. If you just need to give them a little bit of love and they're going to reciprocate for sure. So all these aspects make them the best dogs, and also very little bit of illness, like they hardly fall ill. So they're healthy for, and they also live for, like, I've seen like indie dogs live for 20 years. So
Right.
most of the indie dogs have a good life.
What is the biggest misconception about indies in general in the society?
That they are aggressive, that they are biters, and that they are just waiting over there to harass children. So I think, as I spoke about the behavioral issues where, there's some kind of thing that triggered.
I'm sure.
I think unless you don't just interfere in their business, if you don't tease them, if you don't throw stones of them, I think they're going to be fine. It all depends. Most of their pets, it's like in your house, how you train a dog, the dog is going to be like that. Likewise, with stray dogs, if they have been through some kind of trauma, they're always going to be scared.
Absolutely,
So they're not going to bite because they want to bite. They are going to bite out of, being scared or because of being triggered. So that is a misconception that, stray dogs are going to spread illness. Okay. So what y'all they can do on their part is, a society, it doesn't really cost much for anti-rabies, and even the government has their NGOs and they have their own campaigns. So at least get, if not the antiviral, at least get the dog vaccinated for anti-rabies every year. And then even if such things happen because of unfortunate incidents, then everyone's safe.
Right. And we often see the indies or the strays, run after bikes.
Yes.
Especially at night. So what does it, what causes this? Basically?
This is something I haven't understood at all. I came on my scooty today. This is something that, I'm at a clinic in Goregaon, and there are a lot of lanes where there are feeders who are feeding, and they love tires. I feel, yeah. But then what I did was, I started feeding them every day, like whenever I got time, and now like they are friendly with me. But I think that they have, like, some dogs that have been ill-treated, they do this. But this is the thing with dogs running down behind tires.
Right. So if anybody who is wishing to be a parent and is planning to adopt, what would be your guidance to them? What would you advise them?
Firstly, you can just check if the dog has been dewormed and vaccinated in the last. If it's a puppy, then you have to follow protocol. An annual vaccination, just one. It's just done once. So you have to check that. If not, just get the dog vaccinated. Get the dog checked for ticks. If any tick production is not put, then you can put it. And spend good time with the dog. Feed the dog well. Just focus on the nutrition. Just keep proper food and water available, and a little bit of training. You can do self-training if it's this thing you can train. And exposure to sunlight and outside. You cannot keep a adopted dog and then say, I don't want to take for walks. That's one thing. Enough of playtime, enough of exercise. That's it.
And how fatal is parvo?
Oh, parvo is very fatal. That's the reason we focus on vaccinations. Okay. Sometimes because of vaccination failure, also if the immunity of the dog or puppy is low and the puppy is exposed to a parvovirus puppy, the puppy can get parvovirus. That's the reason we advise all the owners to not interact their puppy with any other dog or puppy until the whole vaccination is complete, because there's an incubation period. Because like I vaccinated a dog and they'll be like, oh, okay, now we can socialize. I was like, no, wait. You have to wait for at least 2 weeks.
And also, how important is it to have your dog free from any kind of ticks and fleas? And what can happen if a dog is infested with ticks?
Tick fever is a thing that you don't want to happen to your dog. Okay, when you talk about ticks, also there are different kinds of fevers that the parasites cause. There's a panel. There are 10 parasites which can cause a tick fever, and depending on the fatality, we do the treatment. Like, if depending on the species, the treatment differs a little, but otherwise in general, it needs to be treated if the dog has tick fever, and for lifelong they need to be under supervision. They need to be protected from ticks. they need to be checked for tick fever because they can always get it again. So I always stress on tick protection. Before talking about fleas, fleas are more rampant in cats compared to dogs. Before there was not many diseases in cats, but right now because of flea, even the cats are getting a lot of hemoprotein diseases because of which they are dying. In fact, nowadays most of the cats have hemoprotein diseases if they have fleas. So that has to be taken care of. It's a must.
Right. Thank you so much, Doc, for your time. I hope you had a good
Welcome.
time,
Yes.
and we wish you all the best.
Thank you so much.
Thank you. Thank you.